We're going to do a porcelain fused to metal, a PFM preparation on tooth number 3. This is a fairly aggressive preparation. It's probably the most aggressive of all of the tooth preparations that we do. But PFMs are also still a very, very important restoration to have in your toolbox. There are some indications where we just cannot do all ceramic, and we need to go with the tried and true porcelain fused to metal. There are many advantages. I'm not going to cover them all here, but it's a very necessary preparation to understand how to do. We're going to use the 1557 carbide burr, just like we have with all of our other preparations, to do guide cuts, to break proximal contact, and do most of our rough out of the preparation. And then we're going to use the large 6878K 018 chamfer diamond. This diamond comes to a tip so that it makes a very nice chamfer margin. It's a fairly aggressive diamond. It's really one of the workhorse burrs or diamonds in our armamentaria. And the facial axial reduction is going to be more than on the lingual. So it's a heavier chamfer on the facial. It's 1.2 to 1.7 millimeters deep facially, and it transitions clear down to 0.5 to 1 on the lingual, allowing for just metal on the lingual if you want. If you want to put metal and porcelain, in other words, if you want a porcelain lingual margin, you need to reduce axially just like you would on the facial, but it's not necessary. So the preparation we're going to show you is one that has a differential where it's heavier on the facial, lighter on the lingual, allows you to be a little bit more conservative with the tooth and not take off so much tooth structure on the lingual, because with this preparation, truly you can take off a lot of tooth structure and get a very small tooth when you're all done. The occlusal clearance that we need is 2 millimeters all the way across from the non-functional cusp on the buccal to the functional cusp and the functional cusp bevel. So we'll start with actually we're going to start with an occlusal check like we would with any preparation, and just make sure that we have a good cusp-fossa relationship, which we do. There's really nothing in the relationship here that would cause us to maybe reduce a little bit less in one area over another. It will be a fairly uniform reduction of 2 millimeters all the way across the occlusal surface. So we'll start by breaking contact. I recommend that whenever you're breaking contact, that you utilize direct vision as much as possible to help you stay away from that adjacent tooth. So doing tooth number 3, we can have our patient tipped way back, turning to the left, and then we can come over at about the 10 or 11 o'clock position like this and get direct access. You can pull that cheek back. They can close a little bit so you're not stretching the patient too much. And then you can go ahead and break those contacts. So I'm going to do that. I'm going to see if I can't hold my vacuum while I'm at it so I don't make too much tooth dust. And we'll start with, I'm going to go up just a little bit. So we're going to start with this distal proximal contact. I'm aiming the tip of that burr toward the gingival embrasure space. So it's angled. It's going to be a little bit over tapered, mesial to distal, and that's based upon the shapes of our teeth that are aproximal to the tooth we're preparing. It's a necessity. Buccolingually, however, I can get that taper near ideal at 6 to 10 degrees because there's nothing limiting the angulation of the burr like there is interproximally. So light brush strokes, and just stay away from that adjacent tooth. That diamond that you're going to put in there is a lot bigger than this burr. So It's just keep a little of the tooth structure between you and that adjacent tooth. I don't know whether you can see that or not, but there's a little sliver of tooth left there that where I'm leaning this burr in, so I'm staying away from that adjacent tooth. Try not to get too close to the gingival aspect at this point. And we'll move to the mesial. Light brush strokes. As you start to break through on the lingual aspect, sometimes that burr, the tooth will throw you into the adjacent tooth. So just kind of be aware of that and watch it so it doesn't move you where you don't want to be. So we've got our proximal contacts broken, and now we're going to have our patient come back up, kind of straight up like that, and tip them back a little bit, and we'll do our guide cuts. Remember, the guide cuts follow the major grooves and the triangular ridges. The triangular ridges are a little bit steeper, and the major grooves might be a little bit more shallow. And remember, the mesial lingual cusp on an upper first molar is very large. It's twice the size of the distal lingual cusp. So we'll start with our buccal groove. So these guide cuts, you'll want to be about 1 millimeter still. You could be a little bit more if you wanted to, because our overall clearance is going to be 2 millimeters. So it's pretty good clearance on this preparation. But if you want to be a little more conservative and allow yourself more time to, more material to refine with your diamond, then stay a little more shallow. Because remember, the guide cuts are allowing you to reference the shape of the tooth pre-preparation. And once we connect those and do our basically geometric reduction of the occlusal surface, then everything else turns to clearance, not reduction amount. We start keying off the opposing dentition, and we try to get clear, minimum 2 millimeters everywhere we can. So there's the lingual groove, the buccal groove, and the triangular ridges that are associated with that. We'll now move to the lingual cusp on the functional aspect. So this is functional reduction, functional cusp, and I'm going to be in the lingual groove first. Remember that lingual groove goes from distal buccal to mesial lingual. It's very easy to transpose that and just straighten it out so it goes straight lingual, and you're going to change the anatomy of the tooth if you do that. This large mesial lingual cusp, the reduction, the guide cuts are fairly flat. They're in the same plane. That aspect of this tooth is very broad and flat. So we'll go ahead and do the rest of the guide cuts for our mesial lingual cusp. And we'll do one more here. And then one back on that little distal lingual cusp. That will come off at a kind of a little different direction. Like like that, and then we'll do the guide cuts for the functional cusp bevel. So we're trying to keep that same distal buccal to mesial lingual direction on that groove. So I'm going to lengthen that burr a little bit. Like that, and then we'll do the same back here on the distal lingual cusp. And then we'll do a couple more guide cuts for the functional cusp bevel on that large mesiolingual cusp. That bird's starting to get kind of dull, but I think it'll last. So the guide cuts are in, and we just need to connect those now. So while I've got this burr lengthened, I'm going to go ahead and connect my guide cuts on the functional cusp bevel first. Kind of get that part done. So a lot of this has to be done in the mirror. It's just the nature of the beast when you're preparing an upper molar tooth. Unless you want to get orthopedic problems in your neck while you're young. So there's our functional cusp bevel, kind of roughed out. We're going to shorten this burr now, and we're going to move to the non-functional cusp reduction. Again, at this stage, you're really just kind of roughing this out, getting the rough dimensions, drop down with some clearance. And then we'll move over to the functional cusp and connect those guide cuts. And it's a good thing because this burr is just about done. I could change it, but I'm too lazy because I think I can finish with it. Okay, so let's kind of clean that off a little bit. And we've done our rough occlusal reduction. We're probably in the 1 to 1.5 millimeter range when it comes to clearance. It's time now not only to throw this burr away, but to get our primary diamond burr for this preparation, and it's this one right here. It's this 6878K 018. It's a fairly large burr. And we're going to refine our occlusal clearance now. So at this stage, I'll have the patient close, probably have him turn to the left again. And I'm going to check and see where I need to take more structure off. I do need Big Blue, that's the 2 millimeter stick, to be able to fit. And I know I'm not even close through most of the area, but that is my target. So I'll put that one back. I'm looking to see where it needs more reduction, and I can tell it's really tight right through here. So I'm going to emphasize that area as I refine this now. I started to flatten out my occlusal reduction a little bit, and so I'm going to steepen it back up a bit as I refine. When you're doing an upper molar preparation, the first area on your occlusal clearance that you want to get right is the non-functional or buccal cusp. That gives you access to then measure further palatally to verify accuracy. So it's getting better. We're trying to mirror the opposing occlusion. It's getting close, but I'm still not quite there, especially at the distal. So we're going to take a little bit more off there. Now, part of that reduction will come into play when I do the functional cusp. So I don't expect to get it completely there just by working on the non-functional cusp. They do connect through that central fossa. So at this stage, I am going to come over and start working on the non-functional. Sometimes you feel like a pretzel as a dentist trying to get good visualization. Okay, yeah, let's see how we're doing. That's getting better. It's getting better. Again, I want to try to mirror that opposing occlusion. See, I'm in the zone now. Might be a little, no, it's about right. We're good there. So we want to see how we're doing as we move across. Now, with this measuring stick, don't expect it to just fly through to the other side. It's a very irregular shape that you're measuring, and so it won't go through always with ease, but it's getting very close. I'm able to fit it through, so I'm getting close. I need to work on the functional cusp bevel now, and I even need to lengthen that diamond, that long diamond, a little bit to get to it. The angle that your functional cusp bevel is cut on is the same angle, the same angulation that I'm using out here on the non-functional cusp. One thing about the porcelain fused to metal preparation, you don't need to round. In fact, you don't want to round. You just need to soften sharp line angles. And the meaning of softening is just taking sharp angles off because they don't reproduce well and they tend to cause problems in the manufacturing process. Okay, I think we're getting very, very close there. And at this point, this blue measuring stick should, if it doesn't go all the way across easily, it should go very, very closely. I can get it through at the mesial. You don't want to have to force this at all. This measuring stick, if it binds up, it's probably under reduced. And so I am able to get it through. I have to work at it. So mesial seems good, and distal seems good. So we do have enough clearance everywhere. We can now move on to our axial reduction. So when doing the axial wall reduction for this preparation, this tooth, the axis of the tooth, is a little bit buccal oriented. So it's aiming out to the cheek a little bit, and so you want to maintain that axis. The best way to do that is to properly line up your buccal axial wall with the axis of the tooth, and then line up all the other axes with the buccal axial wall. Now, the first molar, the upper first molar, is a tooth that occasionally needs two-plane facial reduction just because of the shape of it. And so we're going to purposely put two facial planes into this preparation today so that that we follow that curved contour of the buccal surface of this tooth. And in order to have a uniform thickness of restorative material, we need to restore that. We need to prepare that into two facial planes. Again, the gingival third and the occlusal 2/3. The axis is lined up with the gingival third, not the occlusal 2/3. That is like a large bevel or an angle change. If you try to line the axis up with that, you will be over tapered. You line the lingual axial wall up with your buccal 1/3 axial wall, that gingival 1/3 buccal axial wall. So we'll start with that. That's where I want to line everything up with. Now, because I've cut the occlusal surface off, the only way to really check my axis is to sometimes go back to the tooth behind it, that first molar, and get an idea. We've got a little bit of, our patient is a little overclosed here, so we're gonna open that patient up just a little bit, and we're gonna line up that axis with that the second molar, and then we'll just bring it forward, and that's the axis that we're going to use right there. And so we're going to check frequently to make sure we're not messing it up. It's easy to do course corrections if you kind of go along, do a little bit at a time while you're learning. Even I have to do that, and I've done this a few times. So there's pretty much the axis that we're establishing right there, and I've just kind of roughed it out. Now I can come out to the buccal, so I can have our patient turn to the left a little bit. I can pull that cheek back, get direct visualization, and I can start now just keeping it lined up. I can start to do my facial or buccal axial reduction. Now remember, this is going to be pretty deep out here. We want to be 1.2 to 1.7 overall. And it's real easy to have this margin creep apically on you if you're not careful. So be very, very careful at this stage. It's probably time to check our axis. It's real easy to have it get off at this stage. And it's looking good. With a chamfer margin, you lose all reference points. So you basically have to learn to measure with the burr itself and with your eyes. And you'll get very good at that. I'm going to start to blend this line angle into that proximal surface. And a little more facial axial reduction we're going to need to have that deep enough. It's a long, heavy chamfer at the facial. And the way we make that chamfer deeper is just walk that chamfer diamond up the surface of the tooth, creating a long, sloping margin. Okay, let's clean that off a little bit. Okay, and I've got just a little irregularity there that I need to fix. It's always easier to cut a little more off than to cut off too much. Okay, we're pretty even on that facial wall now. It's even in terms of axial depth, and the margin appears to be pretty smooth and flowing, which is what we want. I'll clean up that little bit of dust just to make sure I'm not lying. Yeah, that looks good. So now it's time to carry this axial reduction interproximally. So again, direct vision, we're going to turn that patient off to the left, and we're going to get direct vision here so we don't come up against that adjacent tooth. If you look at the contours of the mesial of that second molar, my goodness, it's more accentuated on this typodont tooth than it is clinically. It's really sloped, and it makes us over taper mesial to distal. It's just the way it is. Most natural teeth aren't angled quite that much. So we have to avoid that, the mesial proximal surface of tooth number 2. And so we'll come out here, direct vision, better have our patient's head stable, and just keeping one eye always. And remember, as you're going toward the lingual now, you're transitioning from that deeper chamfer, that 1.2 to 1.7, you're going to get real light. .5 to 1. So now we'll come up to the mesial. Always keeping an eye on that adjacent tooth, following the gum line. Okay, and I think we've now gone interproximally. We just need to carry it around to the lingual so we can come back to the 12 o'clock, 11 o'clock position, have our patient straighten back up, and we'll go to indirect vision through the mirror. This is where it is critical. Now we've created this buccal axial wall. That's the axis for this tooth. And we're now going to key off of that to do the lingual axial wall. And if we do that properly, we'll have approximately a 6 to 10 degree taper between those two walls. So we'll key off of the buccal, we'll move it across, go to the lingual. And again, we're going to stop and we're going to check. How are we doing? Good. And we'll just continue on here. Now that we've kind of established the direction of that, we can start to come off to the side and get different views of it. The chamfer diamond, the chamfer margin is really an easy one to get nice and smooth. It's more difficult to get a J-lip with it. Sometimes you'll have the patient tip way over and use direct vision if you want to in this area. And we'll key off of that. I wouldn't operate for this like this for a long period of time because it's going to be hard on your neck. Okay, and there we go. That lingual is just about done, it looks like. Got just a little more blending right there. Still a little bit more right there. Okay, there we are. Now, we're just barely tapered enough. That's good. Okay, so now it's time to put in the second facial plane out here on the buccal surface. And that just, if you were to look down the buccal aspect of this tooth, you would see that the restorative material out here near the cusp tips, it's going to be either quite thin or over contoured or a little bit of both. And so we need to give the lab a little more room out here. And so we're going to just take that occlusal aspect and tip it in a little bit. It compromises our resistance and retention form just a little bit, but it's well worth it for the restorative material aspect. So we're going to move this back like this. We're going to line that up with the contours of these adjacent teeth, and you can easily see where that is, and that's the angle we'll use. The junction between these two planes is right at the occlusal aspect of the gingival third. And we'll take just a little bit more. And now we have room for our restorative material. I need to blend it just a little more right up here. Okay. Now it's time for the non-functional cusp bevel. On this particular preparation, it's 0.3 to 0.7 millimeters wide. It's very slight, but it does take this really sharp angle between the buccal axial wall and the occlusal reduction on the non-functional cusp. It bisects it, basically, and it makes it so it isn't so acute. It makes it into two obtuse angles, and we're going to do that next. It fades near the mesial and distal. It's actually done. Now the last part is softening. We're going to take the sharpest of the line and point angles. They're typically found near the marginal ridges. I can see some really sharp ones back here near the distal lingual cusp, and we're just going to take the sharp edges off. Again, we're not rounding. We're just taking those sharp angles off, which will help us both with our impression and it'll help with the pour up of the impression. I can see a couple of sharp places right here on this mesial lingual cusp, and also back here on the distal lingual aspect. So again, we'll look at it from all different directions, verify that still got a sharp spot right there. And that helps. And if I keep messing with it, we're just going to mess it up. So I think we're there. Check our clearance. That looks good. We're done.